Sudden cardiac arrest is where the heart suddenly stops beating, the patient becomes unconscious, and unless resuscitation and defibrillation is carried out quickly, the patient will die. Everyone's at risk of sudden cardiac arrest in some shape or form. We see cardiac arrest affecting the young as well as the old. Clearly, in the older population, the causes of sudden cardiac arrest are going to be more related to heart disease, where in the young it could be muscle disease, or it could be the heart's electrical system not working properly. When someone suffers a cardiac arrest, they usually collapse immediately, they lose consciousness rapidly, and they are not moving at all, and they are in essence clinically dead at that point. There is a difference between sudden cardiac arrest and a heart attack, and this is often confused. The commonest cause of a heart attack is where there is a blood clot blocking the blood supply to the heart muscle. Not all patients who suffer heart attacks collapse and go into cardiac arrest. Cardiac arrest is where the heart actually stops beating. When someone suffers a heart attack, usually they have some symptoms. The classic symptom would be pain in the chest or a tightness in the chest. Sometimes that pain, tightness or discomfort radiates to other areas of the body such as the arms, the neck. They often feel extremely unwell, whereas in cardiac arrest someone will collapse and become unconscious immediately. When someone collapses in sudden cardiac arrest, it's essential that someone identifies the cardiac arrest as soon as possible, activates the emergency services by dialing 999 rapidly, and while waiting for the emergency services, start some form of resuscitation, in particular focusing on chest compressions, and if there is a defibrillator, a so-called shock box available in the community, that should be brought to the patient's side as quickly as possible. Every minute is important when someone suffers a sudden cardiac arrest. An automated external defibrillator, referred to as an AED, is simply a shock box. You place two pads onto the patient's bare chest, you switch the machine on, and you follow the prompts that the machine gives you, and it will safely deliver a shock if a shock is required. An AED is a simple machine to use. They come in various shapes and sizes. Essentially, you place two pads onto the patient's bare chest and switch the machine on, and all machines will give you voice prompts and often a text prompt on the screen and tell you exactly what to do and when to press a button and when not to press a button. They are safe to use, and everybody should know how to use one. We know that when someone suffers a sudden cardiac arrest, the heart is often in a rhythm that is amenable to a shock. Therefore, it's absolutely essential that a defibrillator is brought to the patient's side, the pads applied, and a shock delivered as soon as possible. It's suggested that for every 1 minute someone is in cardiac arrest, the chances of survival decrease by approximately 10%. If the patient suffers a sudden cardiac arrest and the heart is amenable to a shock being delivered, the faster that shock is delivered, the better the chances are of surviving. If you can deliver a shock within the first few minutes of a patient's heart stopping, the chances of survival are increased dramatically. CPR is an essential skill for everyone in the population to learn. We should be teaching CPR in schools, in the workplace, and it's even suggested that CPR should be known as part of the driving assessment to pass your driving test. CPR is a crucial element if we want more people to survive sudden cardiac arrest. When someone suffers a cardiac arrest, bystander CPR is a crucial element if we are to increase the survival from sudden cardiac arrest. In London, we see bystander resuscitation undertaken in about 51% of cardiac arrests, which is good but not good enough. it's essential that bystander CPR is started, as that will fill the gap between the patient collapsing and the emergency services arriving. Having defibrillators available in the community is another element towards improving survival from sudden cardiac arrest. As I've said, defibrillators are easy to use and should be encouraged to be put into areas where ambulance services may take some time to reach or difficult to access. In London, we have over 900 defibrillators in public places, with over 9,000 people trained in how to use them and provide CPR. The London Ambulance Service has been collecting cardiac arrest data since the late 1990s. Each year, the London Ambulance Service responds to between 9,500 and 10,000 cardiac arrests, and resuscitation is attempted on between 4,500 and 5,000 patients per year. That is a steady number that we've seen over the last few years. So in essence, we see in London between 28 and 38 cardiac arrests a day. Over the years that I've been working in the health service, I've attended many cardiac arrests. Recently I attended a cardiac arrest in a public place where the local staff were trained to use a defibrillator. On our arrival, which was minutes, the defibrillator had already been deployed and chest compressions were well underway. This is a crucial element if we are to improve the survival from sudden cardiac arrest.